My name is Erica, and our group decided to be talking about heat related health incidents in Europe. And this group consists of myself, Erica, Nancy, Aaliyah, Reina, and Hafsa. So now we are going to begin with Reina introducing the health concern.
Health concern. Heat-related deaths in Europe from CBC, August 2024. According to data from the World Health Organization, an average of 175,000 lives are lost due to excessive heat each year in Europe. Deaths related to climate change and high temperature are mainly due to heat stress. Temperatures in the European region, including North African regions and Central Asian countries like Kazakhstan, make up for 36% of the total global heat and are rising at double the average worldwide rate. Heat waves like the ones occurring each summer are seriously aggravating a number of long-term problems such as mental health issues, diabetes, respiratory, cardiovascular, and cerebrovascular diseases like stroke. These fatalities are predicted to increase much more as temperatures keep rising. The significance of this for medical professionals. In order to better manage heat-related health issues and avoid deaths, nurses and other healthcare professionals are essential. Clinicians have to predict and treat heat exhaustion with greater diligence because heat aggravates pre-existing health problems, particularly in groups with illnesses that are already present and those with more vulnerability, such as the elderly and the pregnant. Additionally, healthcare providers must advocate and educate the public about safeguards including staying hydrated, staying in cool areas, identifying the preliminary symptoms of heat stroke, and knowing when to seek help.
So, the first peer reviewed article was published in 2014 by Pennsylvania State University in their Medicine and Science in Sports and Exercise journal. It talks about the impact of rising global temperatures on the cardiovascular health of older adults. With climate change causing more frequent and severe heat waves, the study highlights the increasing risks of the aging populations. So the article discussed how heat waves impact the cardiovascular system of older adults, a group primarily vulnerable due to age-related physiological changes. And during the prolonged heat exposure, the cardiovascular system must work harder to pump blood to the skin to release heat. And for elderly individuals, the strain on the heart, especially the left ventricle, can lead to serious health risks. It emphasizes that due to the combined effects of aging and climate change, older adults face a significant risk of cardiovascular incidents and mortality during the extreme heat events. And most deaths that occur during the heat waves are due to cardiovascular issues rather than direct heat illnesses like heat stroke. Elderly individuals, especially those with pre-existing cardiovascular conditions, are affected the most, and the article emphasizes the importance of specific actions for older populations as global temperatures continue to rise, showing the need for health systems to better prepare for and manage heat-related cardiovascular risks. The second peer-reviewed article was published in 2019 by the International Journal of Environmental Research and Public Health. They examine older adults' response to heat waves and evaluates existing prevention measures using the Ottawa Charter for Health Promotion. The article talks about the unique risks older adults face during heat events as they have a harder time adapting to different environments and often have chronic health issues to add on to that. It highlights that while some preventative measures are in place, such as heat action plans, there's still a need for better evaluations and more active support from healthcare workers to protect this at-risk age group. Utilizing the Ottawa Charter's 5 action areas, the study reveals gaps in the current policies and practices. For example, while some public policies to reduce heat risks have been developed and implemented, not all communities actively include older adults in these prevention efforts, and additionally, some older adults are unaware or just unwilling to follow these protective behaviors, and due to low health literacy or chosen isolation, as some examples. The study also talks about how healthcare providers, particularly nurses, need to actively support heat adaptation for older populations by strengthening community connections and promoting heart health literacy. Carefully reviewing heat action plans can help find better strategies, highlighting the need for a solid plan to protect older adults from heat risks.
Hello, my name's Aaliyah, and I'll be introducing the philosophical approaches. The health issue crisis highlights philosophical approaches pertaining to critical social theory and phenomenology concerning social and structural inequalities that exacerbate heat-related deaths and emphasizing lived experiences to those affected by heat-related issues, specifically the vulnerable group. From a phenomenology approach, the article highlights how aging individuals physically and mentally experience their vulnerability during environmental crisis. The discussion of how elderly individuals experience low immunity compromises cardiovascular responses, which can lead to an overwhelming physical demand on the body and cause an impairment on thermal regulation. Additionally, elderly citizens can occasionally be undermined by people in general, because they are viewed as weak and frail by society. Elderly people do not receive the attention and care they need. By acknowledging these issues, it ensures that healthcare and public health responses take into consideration and respect the complexity of individuals' lived experiences, allowing us to sympathize. This leads to better healthcare outcomes, inequality, and human-centered care. According to Vu, Rutherford, and Fung, 2019, the gradient of health to illness corresponds to social gradient of high to low socioeconomic status. From a CST perspective, it is important to take into consideration the vulnerable population like the elderly, especially with thoughts and behaviors to implement and concentrate on improving certain policies and procedures to support them. Furthermore, during the French heat wave, mortality rates in underprivileged neighborhoods were twice as high than those in privileged areas. Individuals in low-income areas and those with limited access to healthcare are disproportionately affected by climate change. By acknowledging the CST, this health crisis can lead to promoting holistic health solutions. This allows us to focus not only on certain health outcomes, but also on broader societal issues which promote comprehensive and equitable health solutions. Additionally, it allows people of higher power to consider structural change to reduce inequality. In acknowledging this, healthcare practitioners, policymakers, and society can push for reforms that create a fair, more inclusive system serving everyone equally.
And I'll be talking about cultural considerations here on this slide. So this picture right here shows a woman drinking water on a very hot day in Athens. Not only that, but it also includes many middle-aged women and men, which would make the audience think that this particular group is being affected by the heat wave the most. However, elderly people aren't being shown in this photo, which could suggest that this type of culture is the one being marginalized. Culture has various meanings depending on the context, but in this case, culture is the vulnerable population of elderly people. According to CBC News, they said, the extreme heat that we're experiencing is a particular problem for elderly people, especially those living alone. Elderly people living alone are isolated and separated not only from society, but from their families as well. They're being treated insignificantly because those living alone have limited resources to prevent long exposure of heat, while those who have company have access to resources. Another way this culture is being marginalized is due to their susceptibility to chronic diseases, such as cardiovascular diseases. The journal Heat Waves, Aging, and Human Cardiovascular Health suggests that long exposure to heat can induce stress on the cardiovascular system, which can negatively exacerbate chronic conditions that are related to cardiovascular diseases.
Two key ways to address heat-related health risks in nursing are through patient education and advocacy for community resources that protect vulnerable groups. Nurses play a vital role in educating at-risk populations on hydration, using cooling methods, and recognizing the signs of heat-related symptoms. By teaching these kinds of skills, nurses empower patients to practice preventive measures against heat hazards. In the 2019 article published in the International Journal of Environmental Research and Public Health, the authors emphasized that empowering communities to take charge of their own fates through collective decision-making, planning, and execution contextually relevant priorities ensures healthier lives as a whole. By encouraging simple preventive actions, nurses help reduce the risk people face during extreme heat, making it easier for them to stay safe and healthy. Furthermore, nurses can advocate for heat safety resources and policies focusing on at-risk groups like the elderly and those with chronic conditions. This includes supporting cooling centers and working with public health organizations to spread awareness and improve access to emergency resources during extreme heat. These efforts help build resilience and support long-term health for all.